Greetings of positivity, everyone. This is Dr. Locquiao, and I would like to share to you this video lecture about introductory concept of legal and ethical issues in psychiatric and mental health nursing. To begin with, I would like to share with you bits and pieces of information about legal and ethical issues in healthcare alongside of the mental health care. So we have this Mental Health Care Act of 2017, which explicitly talks about the right of patient with mental illness. This act lays down the ethical and legal responsibilities of all healthcare professionals alongside as they work with the government. The rights of the patients with mental illness are at par with the fundamental rights of human beings and needs to be clearly talked about, because of course they belong to the most vulnerable group of people in the society, and so we have to talk about details of how to take care of them legally in terms of evaluation, treatment, and even research perspectives. Those rights that are mentioned in this Healthcare Act translate into ethics of psychiatric care in a different form that relates to respect of autonomy. The principle also includes principle of non-maleficence, beneficence, confidentiality, or things about disclosure, boundary violation, informed consent, and voluntary treatment in case they'll be hospitalized in an involuntary way. All these are the ethical sides that we'll be dealing with in this lecture. And then if you look into the ethical side of it, recalling your definition what ethics is all about, ethics is defined as a set of moral principles, especially one relating to or affirming a specified group, field, or norm or form of conduct. Technically, ethics talks about morality and the desirable way of behaving, but may not be binding among individuals. However, when it comes to medical ethics, these are essential. I repeat, these are essential, not only desirable requirements based on which a physician or a healthcare provider is mandated to act. So the legal aspect of patient care are determined by country-specific regulation, which in turn are governed by medical ethics. So when you move from one country to another, you have to update yourself with the ethical and legal standards of taking care of mentally ill clients. As we move along, we'll be perusing each part of those that we have mentioned. But before that, to begin with, I would like you to watch this video clip that I have included so as to give us a motivation and a challenge to think of situations like this that you will be encountering soon when you become professional nurses. Let us look into the video clip.
So, a gardener wants to barter landscape and lawn maintenance for treatment for maldepression. He gets rid of crabgrass and she gets rid of crabbiness. Sorry, but I don't like it.
Why not? It's not illegal.
No, it's not, putting aside possible tax questions.
It's not unethical.
Could be.
Well, I've checked the ethical codes for psychologists, social workers, and marriage and family counselors, and not one prohibits barter as unethical.
True, but note the tone they take in the language of the sections that deal with it in the codes. They are all cautious about permitting it and warn about not allowing it to become exploitive of the client or patient, or else it would be unethical.
Yeah, but what's so special about a provision that cautions against exploitation of a client? I mean, wouldn't that be true of any professional act that exploits a client?
Yes, it would, but this is a very particularly tricky area. I'm very conservative about advising my clients in the area of barter. It could easily turn into exploitation without the therapist intending it as such.
Explain.
Joseph has always maintained that bartering therapy for services is complicated and by its very nature prone to exploitation.
I make a clear distinction between bartering therapy for services by the client and bartering therapy for goods, merchandise.
What's the distinction?
Here, I agree with Joseph. Let's say, for instance, that Bob landscapes Alice's home, maintains her lawn and yard, sprays her fruit trees, whatever. Suppose Bob just does a lousy job, or suppose he does an adequate job and the therapist is persnickety about her lawn. Does this become a therapeutic issue? Do they talk about it in therapy? Maybe.
Well, I mean, I can see how this could get complicated, but where's the exploitation?
It's not uncommon in certain phases of therapy for the client to try hard to please the therapist to gain approval.
Oh, yeah, I can see where this is going.
Exactly. Does Bob overdo it? Does he try to become the best doggone landscaper that Alice has ever seen? Does he do more for her than he would for any other customer?
Well, I know that in your mind, you are thinking so much about things that you will soon encounter as psychiatric health nurses, and for you to be able to feel confident and earn that self-esteem that you have to have when you work in the clinical area, you really have to equip yourself with knowing what you need to do, what is not needed to be done. And the legal and ethical aspect of mental health care will help you a lot in preparing yourself to become very comfortable and confident in assuming your role as future nurses. So, legal and ethical aspect of mental health care is a very, very significant topic that each of us must know and must be updated. The Mental Health Care Act of 2017 explicitly talks about the right of patients with mental health illness. And this act lays down ethical and legal responsibilities of mental health care professionals along with the government. So this Mental Health Act specifically identified the fundamental role of healthcare professionals along with working hand in hand with the government. I mentioned a while ago that the Mental Health Care Act emphasizes that the rights of patients with mental illness is at par with that of the rights or fundamental rights of individuals. And in the following slides, we will look into those specific rights that we wanted to illuminate in terms of dealing with psychiatric patients. Okay, first is the right to informed consent. Of course, it is a battle of mind whether or not the right to informed consent is being provided to these patients in such a way that we are really looking into the right as individuals. So under the right to informed consent, you will see that there are 4 conditions where treatment may be performed without obtaining informed consent from the client with mental problem or mental illness. First is that the client is found to be incompetent. Second, if it endangers the life of or health of another person or the client, him or herself, an emergency situation, and a client below 18 years old. This case, in my experience working with the mental institutions, the psychiatric doctors usually are the ones who sign consent for them in the absence of their family members, because for everybody's information, especially in the National Center for Mental Health, majority of our clients are already abandoned. They don't have families, friends to receive the informed consent or to give consent for them. So in that specific example, the psychiatric doctors are the one who assumes the responsibility of signing or giving the consent for the client. We also have the right to treatment or to refuse treatment, which is, of course, a very good example of showing that the client has the right to autonomy. So if the client's competency is questionable, the physician can give the information to a legally appointed guardian or family member designated by the patient. However, like I said, most or majority of our clients in the National Center for Mental Health are abandoned. However, in other situations like family is really there, very supportive of them, then right for autonomy is really due for them. So we give the client and the family members the right for autonomy. Another is right to confidentiality and privacy, which is of course very, very, very important, and this is a very sensitive topic in terms of patients who are psychiatrically ill, because well, not only in the Philippines but even in other parts of the world, there are still families who are very conservative. They don't want to disclose information about conditions like this because they still believe that this is a social stigma and they wanted to keep them within the family. So confidentiality and privacy is very important. We have to consider that. So disclosure of records and all that is only true to members of the healthcare team, and if and when it's really needed. We also have right of the client for reproductive and sexual right to marry, have kids, use contraceptions, and follow lifestyle of their own, which is of course very true among clients who are seeking psychiatric help from private institutions. However, again, I'm sorry, but the very good example and the very common example that I can give you is that of the National Center for Mental Health, because that's the institution which is very known in our country, and the institution where you are going to be exposed hopefully soon after COVID is done. And so just to give you bits and pieces of the information that you will soon encounter there, these rights and privileges are not actually given to them, but in a way it is, because I have seen some patients in the National Center for Mental Health who are pregnant and who have developed a relationship with other patients from other pavilions, and they are allowed. However, those are manageable patients, and they are usually helpers of the National Center for Mental Health already. So they are given the privilege to go out of the pavilion, go to other pavilion to transact or to do something like buy some food or communicate something. Then they get the chance to meet other people, and they just find love. So aside from the reproductive and sexual rights, we also have the right to treatment in the least restrictive environment appropriate to their needs. So we are now looking into situations pertaining to restraints and seclusion. As we move along, we'll learn more about restraints and seclusion in a more detailed way. Now, I want you to take a look at your slide number 9. I included a photo of the entrance area of the National Center for Mental Health, just to give you a little bit of an idea how the environment looks like. The next slide will show you photos of the clients inside the pavilion. These photos were taken from a reliable and credible source. These areas are just few of the areas where I am assigned before as a clinical instructor, and this is the actual scenario that you can see inside the hospital or inside the institution. So in blue clad are the male clients or patients, and the rest are the female patients. Those who are wearing yellow are actually female adolescent patients. So I just wanted you to take a look at the photo so you can have an imagination of how it looks like. Now let us proceed with the legal and ethical issues. First, we have beneficence. Beneficence is the duty to act to benefit or promote the good of others. And we have here an example is spending extra time to help calm an extremely anxious patient. So some nurses are very dedicated and passionate of their work. They can give extra time beyond the hours of their work to make sure that they are able to help patients and staff per se. And that specific act is very good in nature in such a way that it specifically help others, not only the patient but the significant others. We also have autonomy, respecting the right of others to make their own decisions. So example is acknowledging the patient's right to refuse medication promotes autonomy. Being a nurse, this is very challenging because, of course, if all our clients will avoid or will not agree or refuse to take medication, and we think that we need to honor it or acknowledge it because we promote autonomy, then the nurse-patient relationship will never be therapeutic, right? But our role as a nurse here is very significant and vital because the way we communicate with them, the way we educate them, the way we deal with them has a very big impact in terms of their decisions, even if they know that they have the right to autonomy. So if we are able to explain to them the need of certain treatment or medication or whatsoever and convince them that this is really for their welfare, then we can avoid legal and ethical issues relative to the right of the patient for autonomy, because they will agree to whatever is needed to be done to them for the welfare of their health. Another legal and ethical issue is justice, which is the duty to distribute resources of care equally regardless of personal attributes. I know that you've been exposed to the clinical area and you have encountered or witnessed some situations where you feel that fairness is not justified, and in this specific example you have so much to share and talk about, and we'll be talking about that in the actual face-to-face class. But we have here an example. An ICU nurse devotes equal attention to someone who has attempted suicide as to someone who suffered from a brain aneurysm. So, like the definition says, when you talk about justice as a legal and ethical issue in dealing with patients, especially in the psychiatric setting, we do not identify who to prioritize. We have to make sure that whatever the attribute is, we have to really give the care due for them in the most justifiable way. Okay. Another legal and ethical issue is non-maleficence, which is doing no wrong to the patient, doing no harm to the patient, whether intentionally or unintentionally. And again, a lot of social issues about non-maleficence is out there, and the healthcare practitioners are always the actors and actresses in terms of issues like that. And we have here an example: maintaining expertise in nursing skill through nursing education. So looking into the definition, we mean no harm to any client, whether it's intentional and unintentional. And so, as the example suggested, maintaining expertise in nursing skills, being knowledgeable and competent is the key for us to be able to do no harm to our clients. So it's our sole responsibility to do that in terms of improving ourselves. Veracity is another legal and ethical issue. This is one's duty to communicate truthfully. I repeat, one's duty to communicate truthfully. Example, describing the purpose and side effect of a psychotropic medication in a truthful and non-misleading way. So when we talk to the family members of psychiatrically ill patients, we have to be honest to them. We have to tell them whatever side effects are expected from certain psychotropic medications, so that the family will not be misled with the lack of information that some healthcare providers are getting into. Okay, another is fidelity, and this is the last one. Fidelity is obligation to honor commitments and contracts. For example, if a nurse promises her patient that she will be available during the procedure, then the nurse should be there during the procedure. Do not think that because they are psychiatric patients or psychiatrically ill, they do not know what's happening in terms of communicating with them. You'll be surprised, and sometimes you even knock on your head and say, oh, is he or really a psychiatric patient? Because they still have their lucid intervals where they can remember things. If you take care of them in a very special manner or in a very honest manner, you'll be surprised that they tend to remember you. And even when they have difficulties facing some procedures, facing even some staff, they don't want to talk to them, and you convince them to do so, and they said, yes, but can you be there? And you said, yeah, I'll be there. Make sure that you will, because it will help them a lot psychologically and emotionally. And that's fidelity. We don't just do fidelity with the people we love, but it's a part of our profession as nurses. So we have to practice it with the care that we provide with the patients. The next slide, which shows you a video clip about patients' confidentiality, have so much information about how important it is to take care of the patient's personal information or patient's health information.
A young celebrity is taken from her home by ambulance to the nearest emergency department. Reporters swarm the hospital exterior, waiting for photos or to talk to a staff person who's willing to divulge even a tidbit about the event. Somehow, a photo will be taken inside the hospital and published in a tabloid. An all-star athlete goes into an exclusive rehab facility. Again, reporters want to know the details of why he was admitted and how long he will be there. An ordinary citizen goes into a local bank for a loan, but the manager somehow learns from his physician friend that this person has a serious medical condition, and so the application is refused. Are these examples immoral? Yes. Unethical? Yes. But they are also against the law. HIPAA legislation states that all protected health information, or PHI, about a patient is private and must be held in confidence by all professionals in healthcare until the patient gives permission that it be shared with the people he or she specifically designates. There are some exceptions, however. If the welfare or safety of one or more people is jeopardized, confidence may be broken. This can occur in cases of child or elder abuse, or domestic violence, or in instances of criminal behavior. In addition, data concerning vital statistics, communicable diseases, or industrial accidents can be shared with government agencies. Otherwise, PHI is just that, personal and private and protected. Professional organizations have also issued statements and recommendations about patient privacy. The American Nurses Association established standards which include a patient's right to privacy with respect to his or her individually identifiable health information, which includes genetic information, research records, and mental health therapy notes. Access and review of his or her own health information, as well as the right to supplement it, so he or she can make informed decisions, correct erroneous information, and discuss any discrepancies noted. And receive easily understood notifications as to how his or her health records will be used and why they can be given to third parties. In addition, the ANA recommends limiting the use of PHI as much as possible, that the use or disclosure of PHI absent of a patient's signed information consent document be prohibited unless there is a threat to the public or a compelling law enforcement need, and that safeguards for the use, disclosure, and storage of PHI be developed. The American College of Healthcare Executives also states that there is a moral as well as legal obligation to protect private health information. Some of this group's recommendations include limiting PHI access to authorized personnel only, ensuring that policies and procedures reflect the current law, providing education to staff regarding patient privacy, confidentiality, and data security, implementing technical, administrative, and physical safeguards to protect medical record files, conducting periodic security audits and risk assessments, and conducting timely investigations and promptly notifying patients if there are breaches.
And so in terms of patient confidentiality, you have to remember two most important considerations. Number one is ethical consideration. As you see in the slides, the American Nurses Association Code of Ethics for Nurses in 2001 asserts duty of nurse to protect confidentiality of patient by hook or by crook. That's one of our major responsibility. Another is the legal consideration. The Health Insurance Portability and Accountability Act, known as HIPAA in 2003, also emphasizes that the health information may not be released without patient's consent, except to those people for whom it is necessary in order to implement the treatment plan, which is, of course, the members of the healthcare team. However, we can see that there are also exemptions, like duty to warn and protect the third parties. In this specific portion, we can have the cases of COVID as an example. Nowadays, when someone is diagnosed with COVID, although not directly, the names are not directly listed in the notices or memos given to people around the community, they are listed in such a way that it will help the healthcare team protect the individual positive of COVID and the people around that person who is positive. So that's an exemption. You have to disseminate the information simply because you wanted to protect other people, right? So most states have similar laws regarding duty to warn third parties of potential life threats, and staff nurse reports threats by patient to the treatment team. So those are the things that you have to take note in terms of patient's confidentiality. Next slide, we can see the mental health laws, which talks about civil rights and due process. I would like to emphasize here the term massive curtailment of liberty, which is due process in civil commitments, or court have recognized it in terms of involuntary commitment to mental hospital. Maybe it's not that easy for you to actually understand this concept, but I want you to know that here in the National Center for Mental Health, majority of the clients are admitted involuntarily, and that because of the admission that is involuntary in nature, the massive curtailment of liberty is being talked about in cases like that. Because when somebody is being admitted in the National Center for Mental Health, again, I'm talking about NCMH, I'm sorry. Most people who are admitted are actually 60 to 70% involuntary in nature, simply because most of psychiatrically ill patients in our country are abandoned by families, and so they became vagrants. They roam around places, and government officials who are bothered by their presence and threat to other people in the society brings them to the National Center for Mental Health. And for your information, the National Center for Mental Health only do what we call discharge to relative policy, which means if someone is admitted in the hospital and no family members will be coming to discharge you, then you stay there forever. And that is an example of massive curtailment of liberty. To continue, let us look into mental health laws that pertains to admission to the hospital. So we have 4 ways of admitting clients in the mental institution. First is voluntary in nature. Can be the client recognizes the signs and symptoms and wanted to seek help, or family members will bring their family who is having psychiatric or mental problem in certain institutions. And we have emergency involuntary hospitalization because it's needed, observational or temporary and voluntary hospitalization. I know you're very much interested in involuntary admission. So a while ago, I have mentioned a little bit about it in terms of the setup that they do in the National Center for Mental Health. I know it's also true to other countries that when clients are unable to take care of themselves and they become a threat to the surroundings, to other people, and of course people in the community and all else, then involuntary admission is done without the patient consent. Next slide, we'll be talking about criteria for hospitalization of mentally ill clients, and we have 4 main criteria. Number 1 is the client is a threat to himself or herself, and we have mentioned it a while ago. We cannot afford clients to be hurting themselves, so we have to bring them or admit them in mental institutions or hospital. Another is the client is a threat to the safety and well-being of others. Third is the client is unable to provide basic need for him or herself, and he's already out of control. So those 4 criteria are the very reason why clients are being admitted in mental institutions, be it voluntary or involuntary in nature. So those are the 4 specific criteria for hospital admission. We are done with some discussions about the legal and ethical issues in psychiatric and mental health nursing. Now let us look into the nursing liability that we have in terms of dealing with clients or patients like that in the hospital. So here, nurses are responsible, of course, for providing safe, competent, legal and ethical care to clients and families. And for that specific reason, we have here some things to bear in mind in terms of those liability. First, we have false imprisonment. So we cannot detain or we cannot confine a client or a patient for any length of time without any medical reason or doctor's order. Otherwise, you will be charged of false imprisonment. Another is invasion of privacy. The violation of the patient's right to be left alone and free from unwanted contact, intrusion, or publicity. Invasion of privacy is connected with that of confidentiality, because publicity or sharing information about the client is actually a part of invading their privacy. So we have to consider the roles that we have in terms of keeping the patient's health information confidential, so we are not liable of invading their privacy by sharing information. And again, not only that, we invade their privacy when when we don't give them privacy whenever they needed to have it, especially if the client just need some time to be left alone for some reason that is not really affecting him or her in terms of health and safety, then that's okay. We still have 3 other nursing liabilities. Third is respondeat superior, which means that the employer is responsible for the acts of its employee, thus liable for damage to the third parties. Another is negligence, which is the commission or omission of act that a prudent person, a person in the right state of mind, could have been done to harm a patient. And last will be malpractice, will be liable in terms of incorrect way of doing things that may cause harm to our patient or client. So those 5 are the nursing liabilities that we have, not only when we talk about psychiatric patients, but also all patients in general. We are done talking about the nursing liabilities that we have in terms of failure in doing our responsibilities as nurses in the legal and ethical way. So let's look into the steps to avoid those liabilities that we have mentioned a while ago. First, practice within the scope of the nursing law. So wherever you go, wherever you intend to practice your profession, make sure that you make yourself aware of the nursing laws in that place or country where you wanted to practice your profession to avoid liability. Another, collaborate with colleagues to determine the best action. So there's no harm of asking people for help, especially if you know that this is for the betterment of not only the patient but for yourself. So you have to learn how to collaborate with other people and come up with what's best for everybody. Another is use established practice standard to guide decision and action. Another, develop effective interpersonal relationship with clients and families, and for you to be able to do that, you have to be good in terms of communicating to people, be it communicating through words, or of course spoken language. Body language can also help, right? So you have to be good in communication. You have to know how to talk to people, assert yourself, make sure that you are communicating in such a way that you are polite and you are able to communicate so well because you are a good listener and all that. And also accurate documentation of assessment data, intervention, and client response to care. So documentation, that is very important. This will give a very clear evidence in terms of whatever is needed in cases of legal and ethical issues in our practice. So you have to document well. This is an issue which is very significant because it has been affecting a lot of clients or patients in different mental or psychiatric facilities or institutions or hospitals. I've seen a lot actually of how these patients are being restrained and secluded, although it is approved and it is with a doctor's order, but sometimes you still don't find it justifiable. For example, in the National Center for Mental Health, we sometimes isolate patients, and if you can see the isolation places where they are secluded, you will not really find it pleasing, comfortable. Well, they say it's expected because it's a government institution, but still, you feel like it's not humane in nature. Same is true when they do, restraining. When they do restraining, they use soft cloth, like, materials to restrain the patient. but the manner of how they do it is heartbreaking at times. I've seen a lot in mental hospital. What I heard from now is it's being improved because of the awareness that the Mental Health Act is pushing through in terms of restraints and seclusion, and I hope that it will get better and better in the future until we already are free from restraints and seclusion, because some institutions in other parts of the world, they are now restraint and seclusion free. They have devised ways of how to manage clients without restraints and seclusion, but most of them actually utilizes medications to calm patients so as not to hurt themselves and hurt others as well. We have mentioned earlier that negligence and malpractice is an act or omission of an act that breaches the duty of due care that results in a person's injury. This time, let's try to take a look at the elements necessary to prove negligence or malpractice. And the first is duty. So, there has to be duty in order for us to prove negligence and malpractice, which means that the plaintiff must show that the defendant owed her a legal duty of care under circumstances. For example, the relationship between the doctor and the patient, or the nurse and the patient, which means that the duty of care is there. As a nurse on duty, you are expected to provide care to that specific client, and if and when something happened to that patient, you are liable because you are on duty. Okay, so that's the first element. Another element that we have is breach of duty. What do we mean when we say breach of duty? So when we say breach, this describes the situation when the defendant failed to meet their duty of care by acting or failing to act in the required way. So to determine if someone breached their duty of care, a court used the reasonable person or standard, which is based on how an average individual would responsibly act in that similar situation. For example, we have the so-called standard of care among us nurses. So that standard of care will be the basis of trying to compare what happened to this specific situation to that of the standard of care expected of the nurse to do. So that's what they are referring to as a reasonable person. Then the defendant will be found to have breached the applicable duty of care. So that's the second element that we have. Third is causation. And causation is being identified in two ways. So causation means that it is also necessary to show that the defendant's breach of duty of care actually caused the plaintiff's injury. And like I said, it comes in two types. We have cause in fact and proximate cause. So cause in fact is based on whether the negligent act was the actual cause of the injury. This can be established by using the but-for test. In other words, causation is established if it is shown that but for the action of the defendant, the injury not have happened. For example, if the driver did not run the red light, then there would have not been an accident. And comparing it with that of proximate cause is more complex. Proximate cause is based on whether the defendant could have reasonably foreseen that their action might cause an injury. In other words, the defendant should have reasonably anticipated that her conduct could result in someone being injured. For example, someone should reasonably foresee that drinking while driving can result in a serious car accident, as simple as that. So defendants are usually not liable for the injuries that were unpredictable or could not be reasonably connected to their conduct. In proving negligence and malpractice, we have mentioned that they try to check onto the standard of care to prove that there was a breach in terms of the duty of care. So now let's look into the standard of care that we are mentioning. And here we have the roles of the psychiatric or mental health nurse in terms of the standard of care. And in assessment, the psychiatric mental health nurse collects clients' health data, and the nurse should consider everything that we talked about in terms of the legal and ethical issues. Here, we also included the role of the nurse in terms of diagnosis, outcome identification, planning, and implementation. So, everything that's listed here in the standard of care are the basic point of comparison that the law will look into if and when there is an omission or commission of crime and they wanted to prove if there's negligence or malpractice in that particular scenario. So as student nurses, you have to look into the standard of care and make sure that you're aware of it, because soon when you'll be practicing, you get to apply whatever you learned from school, and it will lead you into the correct practice or the wrong practice that might lead you to negligence or malpractice. Under the standard of care, we have number 5, which is implementation. And under implementation, there are specific things that a psychiatric nurse has to fulfill, and we have here a list of them. Counseling is included, milieu therapy, or providing a conducive therapeutic environment for the client is one of the major role of a nurse. Another is self-care activities, so be facilitating self-care among the clients. Well, you may think it's very impossible because of course they are psychiatrically ill patients, but my experience of more than a decade in the National Center for Mental Health, I can compare, and I can even tell you that sometimes it's easier to give instructions to psychiatrically ill patients rather than normal individuals, to be perfectly honest. Yeah, sometimes if you call them, let's go sit down and let's wait for your turn to wash your hands, or let's wait for your turn to brush your teeth or to take a bath, they will do it. They will follow your instruction, compared with normal individuals who doesn't care at all. In addition to the standard of care under implementation, nurses or psychiatric nurses are also expected to do their standard of care along psychobiologic interventions. And it means that nurses uses knowledge of psychobiologic interventions that applies clinical skills to restore the client's health and prevent further disability. So the role of the nurse in terms of providing this psychobiologic intervention is really a major a major factor that will help the client improve, or if the nurse is not able to fulfill this implementation role under the standard of care, the client may not improve and further disability might happen. Last will be health teaching, which is of course a very common role of the nurse in all setting. We are known to be very good in terms of health teaching, and the standard of care in terms of implementation under health teaching, the psychiatric mental health nurse, through health teaching, assists clients in achieving satisfying, productive, and healthy patterns of living. So we have psychiatric nurses should be very, very good in terms of therapeutic communication. We cannot afford to communicate to the client in such a way that we are factors of them. Instead of progressing, or instead of improving, they become more dissatisfied of the kind of life that they have. They get to become more aggressive, and improvement is not seen on them. Then that's also a part of our role as psychiatric nurses. That ends our video lecture about the introductory concept of legal and ethical issues in psychiatric and mental health nursing. Again, this is Dr. Locquiao.